Wernicke's encephalopathy is a neurological disorder characterized by thiamine, vitamin B1, deficiency and is commonly associated with chronic alcoholism, malnutrition, and gastrointestinal disorders. Thiamine is an essential nutrient required for various cellular processes, including carbohydrate metabolism and neurotransmitter synthesis. In this script, we will explore the different aspects of Wernicke's encephalopathy, including thiamine transporters and absorption, genetic polymorphisms, mitochondrial dysfunction, blood-brain barrier dysfunction, neurotransmitter dysfunction, histopathological alterations, advanced imaging techniques, animal models, neuroinflammation, cognitive impairments, neuroprotective strategies, and precision medicine. By examining these topics, we hope to deepen our understanding of this condition and develop effective therapeutic interventions. Thiamine transporters facilitate the absorption and distribution of thiamine throughout the body. In the gastrointestinal tract, thiamine is absorbed via active transport mechanisms, primarily in the jejunum and ileum. Thiamine transporters, such as the thiamine transporter 1, THTR1, and thiamine transporter 2, THTR2, play a crucial role in this process. THTR1 is predominantly expressed in the intestinal epithelium, while THTR2 is mainly found in the liver, brain, and kidneys. Mutations or alterations in these transporters can lead to impaired thiamine absorption and subsequent deficiency. Genetic polymorphisms can impact thiamine metabolism and increase the risk of thiamine deficiency. Single nucleotide polymorphisms, SNPs, in genes related to thiamine transporters, thiamine pyrophosphokinases, TPK, and thiamine triphosphatase, TPT, have been associated with altered thiamine levels. Additionally, genetic variations in enzymes involved in thiamine phosphorylation, such as thiamine pyrophosphokinases, TPK, and thiamine diphosphokinase, TDPK, may affect thiamine utilization and contribute to thiamine deficiency. Thiamine plays a vital role in energy metabolism, particularly in the mitochondria. Thiamine pyrophosphate, TPP, the active form of thiamine, serves as a coenzyme for key enzymes involved in the tricarboxylic acid, TCA, cycle and oxidative phosphorylation. Deficiency of thiamine impairs these processes, leading to mitochondrial dysfunction and reduced ATP production. This energy deficit can have profound effects on the brain and other organs, contributing to the pathogenesis of Wernicke's encephalopathy. The blood-brain barrier, BBB, plays a crucial role in maintaining the homeostasis of the central nervous system. Thiamine transport across the BBB is mediated by specific thiamine transporters expressed on cerebral endothelial cells. Disruption of the BBB, which can occur in conditions such as prolonged thiamine deficiency, alcoholism, and systemic inflammation, can impair thiamine transport and contribute to the development of Wernicke's encephalopathy. Understanding the mechanisms underlying thiamine transport at the BBB is important for developing targeted therapeutic interventions. Thiamine deficiency disrupts neurotransmitter synthesis and transmission, leading to neurological manifestations observed in Wernicke's encephalopathy. Thiamine is required for the synthesis of key neurotransmitters, such as gamma-aminobutyric acid, GABA, acetylcholine, and glutamate. Deficient levels of these neurotransmitters can contribute to cognitive impairments, memory disturbances, and motor abnormalities seen in patients with Wernicke's encephalopathy. Restoring thiamine levels and optimizing neurotransmitter function are essential for managing the neurological symptoms associated with this disorder. Histopathological examination of brain tissue from individuals with Wernicke's encephalopathy reveals characteristic alterations and structural changes. These include selective neuronal loss in specific brain regions, such as the mammillary bodies, thalamus, and cerebellum. Other findings may include gliosis, microhemorrhages, edema, and capillary dilation. These histological changes provide insights into the pathophysiology of Wernicke's encephalopathy and help in its diagnosis. Advanced imaging techniques, such as positron emission tomography, PET, and single photon emission computed tomography, SPECT, have provided valuable insights into the functional and structural alterations associated with Wernicke's encephalopathy. These techniques allow us to visualize changes in regional cerebral blood flow, glucose metabolism, and neurotransmitter receptor density. Furthermore, functional connectivity studies using magnetic resonance imaging, MRI, have revealed disruptions in neural networks implicated in cognition and executive function. Integration of imaging findings with clinical assessments aids in the diagnostic and prognostic evaluation of patients with Wernicke's encephalopathy. Animal models have been instrumental in unraveling the cellular and molecular mechanisms underlying Wernicke's encephalopathy. These models involve inducing thiamine deficiency in animals and studying the resulting neurological and histopathological changes. Animal studies have demonstrated the involvement of oxidative stress, excitotoxicity, inflammation, and impaired energy metabolism in the pathogenesis of Wernicke's encephalopathy. Findings obtained from these models help guide the development of novel therapeutic strategies. Neuroinflammation and immune responses are implicated in the pathophysiology of various neurological disorders, including Wernicke's encephalopathy. Thiamine deficiency activates microglia, the resident immune cells of the central nervous system, initiating an inflammatory response. The release of pro-inflammatory cytokines and chemokines can exacerbate neuronal damage and contribute to disease progression. Modulating neuroinflammatory processes represents a potential therapeutic target to mitigate the detrimental effects of thiamine deficiency in Wernicke's encephalopathy. Cognitive impairments, memory disturbances, and executive function deficits are common features of Wernicke's encephalopathy. Thiamine deficiency affects various aspects of cognitive function, including attention, working memory, and information processing. Executive functions, such as planning, decision-making, and inhibitory control, are also compromised in individuals with this condition. The severity and persistence of these impairments vary among patients and can significantly impact their overall quality of life. The development of neuroprotective strategies and therapeutic interventions is crucial in managing Wernicke's encephalopathy. Prompt thiamine replacement therapy is the cornerstone of treatment and can reverse neurological symptoms if instituted early. Additionally, supporting interventions, such as nutritional support, electrolyte balance, and management of alcohol withdrawal, are essential in optimizing patient outcomes. Novel therapeutic approaches, including targeted drug delivery systems and antioxidants, show promise in neuroprotection and may enhance recovery in patients with Wernicke's encephalopathy. The identification of novel biomarkers holds significant potential in the diagnosis, prognosis, and monitoring of Wernicke's encephalopathy. Biomarkers, such as thiamine metabolites, inflammatory markers, and genetic variants, may provide valuable insights into disease pathophysiology and individualized patient management. The advent of precision medicine has opened doors for tailored therapeutic approaches based on an individual's unique molecular profile. Integrating biomarkers and precision medicine concepts can revolutionize the management of Wernicke's encephalopathy in the future. In conclusion, Wernicke's encephalopathy represents a complex and multifaceted neurological disorder resulting from thiamine deficiency. It involves various aspects, including thiamine transport, genetic polymorphisms, mitochondrial dysfunction, blood-brain barrier dysfunction, neurotransmitter dysfunction, histopathological alterations, advanced imaging techniques, animal models, neuroinflammation, cognitive impairments, neuroprotective strategies, and precision medicine. Understanding these diverse factors will aid in early diagnosis, appropriate management, and development of innovative therapeutic interventions to improve patient outcomes in Wernicke's encephalopathy.